infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, in late 2018 into early 2019, an outbreak of a form of hantavirus called Andes virus swept through a small town in Argentina, infecting 34 and killing 11. Now, researchers led by a team from the U.S. Army Medical Research Institute of Infectious Diseases, or USAMRIID, attribute the size of the outbreak to a super spreader event. Well, joining me today to discuss Andes virus and the Argentina outbreak is Dr. Gustavo Palacios. He is the Chief of Molecular Biology at USAMRIID, and Dr. Nicholas D. Paola. He's a National Research Council Fellow. Thank you, gentlemen, for joining me today.
Thank you for having me, Robert.
Perfect. Let's go ahead and just start with some general information about hantaviruses. Can you give the audience a short primer on hantaviruses in general?
Sure. So hantaviruses are a group of positive sense RNA viruses that are tri-segmented, and they're typically found in rodent species, and they're globally diverse. I think the first time that we really start to bring attention to hantaviruses and the diseases they cause was in the 1950s during the Korean War. Back then, it was known as Korean hemorrhagic fever. And in the 1970s, hantavirus was discovered to be the causative agent of that, and that was discovered in rodents at the time. And then in the 1993, sin nombre virus emerged in the Four Corners area of the United States, and it killed 50% of the people it infected. And it caused hantavirus pulmonary syndrome outbreak. And the two different viruses, although they're in the same family, they cause different pathologies in humans. And recently, in the South Americas, we have Andes virus, which is also in that hantavirus pulmonary syndrome category. And generally, they jump from rodents to humans, and they are dead-end infections. And with Andes virus is special in that sense that it can go from rodent to human and then continue transmission from person to person.
Now, with the Andes virus, you mentioned it's found in South America. How common is it? Because I haven't heard a whole lot about it.
So it was only discovered in 1995 or 6 in relatively small areas of Argentina. Very unpopulated areas of Argentina. Mm-hmm. And these outbreaks are typically short-lived. They maybe go from one person to two, and throughout the last 2 decades, there's only been a handful of outbreaks. And the scales are quite small. So it's rare in the sense that they typically occur in Chile, and there have been some exported cases that have occurred in the Netherlands, for example. But by no means as common as some of the other infections that we deal with today.
Right. How is the pathology of Andes virus similar to sin nombre virus that's found in the U.S.?
Based on the research that we did, they both have like a broad dysregulated immune response that's highlighted by a cytokine storm. But we think there are differences that we really should explore further. And it's something that we'd like to do in the future and look a bit more closely at that.
Now, it is a viral disease, so is there specific treatment for it, or is it vaccine preventable? What do we have as far as that?
Currently, there are no approved vaccines or therapeutics, but I do know that there is a phase 1 DNA vaccine in trial. But other than that, it's only supportive care and supplemental oxygen.
Right, and it's transmitted to people via exposure to rats, but also with the one unique thing that you said is I believe you said it's the only hantavirus that can be person-to-person transmission. Is that correct?
That is correct. And based on previous outbreaks and on this most recent one in 2018-2019, we show that it is like a large droplet transmission and close contact. Mm-hmm. Unfortunately, it's very difficult to pinpoint exact examples, but we did go over a few of for example, patients sharing hospital rooms together, or all of them attending a wake, and being in these close quarters and having sharing drinks or beverages are some of the ways that we have documented that transmission likely occurred.
Right, and that really takes me back into the outbreak. It was in, forgive my pronunciation, Chubut province. Did I say that right? Chubut, okay, and that's in Argentina. Yeah. What do we know about the genesis of the outbreak, the beginning of the outbreak, and then tell us a little bit about the subsequent large spread?
So the outbreak started in a small village of Puyan, and I think it's a population of about 2,800. It's in the mountainous region, quite elevated, and the initial patient was reportedly going out into the forest looking for vegetables, and he did this daily. And we believe that he was exposed to rodent excreta, feces, or urine along the same lines, and got sick a certain time after. On November 3rd, there was a birthday party, which this individual happened to attend, and that was his first day of symptoms. And he managed to spread it to 5 other individuals. And interestingly enough, days passed. The incubation period for this virus is very variable. I think from 9 to 40 days is the range. And I think 22 days later, another patient was sick, and they managed to spread it to additional number of patients. I don't recall the exact number off my head, but there was 3 primary super spreading events. The initial patient, that second patient who had a lot of home visitors while he was symptomatic and went to the hospital that same day. And then there was the third patient who attended the wake, and that had a lot of people in a very small room. And these 3 super spreading events caused about over 60% of the cases in the entire outbreak.
And it had quite a high fatality rate.
Right, it's 32%.
Yeah, that's amazing. Dr. D. Paola, how did health officials finally get this outbreak under control?
So after the 19th case, health officials and both in the hospital and publicly essentially locked down, similar to what we're seeing today with SARS. They made confirmed patients self-quarantine. They prohibited large gatherings, and this led to a substantial drop in the number of cases, and we did think this actually made a really big difference in containing this outbreak.
Yeah. Now, why is studying this outbreak important, and is what you learned applicable to other infectious disease outbreaks?
So I think Andes virus is a wake-up call. I think there are many other zoonotic pathogens like this that have the potential to cause disease and continually transmit from person to person given the opportunity. And I look at Andes and I see the high fatality rate. I see the propensity to transmit really efficiently between people. And it worries me, and especially with the long incubation periods that some of the patients reported over 20 days. I think that we really need to assess the risk and invest some time and effort into learning more about it.
So,
in terms of the study of spillovers, zoonotic spillovers, Andes is also a unique opportunity. It is the only member of a huge and diverse family of negative strand viruses that is distributed all over the world. with a lot of diversity. There are more hundreds of different named species of these hantavirus genus, and only this virus in the south of Argentina and Chile, in the Patagonia, seems to have the capability of being transmitted human to human. Mm-hmm. Understanding what it is, what are the conditions for that transmission, what are the factors that are driving that transmission event from the zoonotic pool, from the rodent, and second, between humans, is basic for us to understand the concept of zoonotic spillovers. And obviously that is very important for all emerging infectious diseases, as we are seeing right now for in the current pandemic with SARS coronavirus, as Nick mentioned previously.
Right. As far as Andes virus, though, we're talking about a reasonably large outbreak. But is this virus and the infection found sporadically in individual cases throughout the year in Argentina and that area of the world?
I'm going to have to defer to Gustavo on this one, but I think, based on what I remember, there are sporadic cases, but I don't know how intact surveillance is, like how often this is, because it is relatively rare, as we said.
Right.
And I think because of this outbreak, things will change down there, where they will implement some new strategies and some safeguards that would prevent future outbreaks like this from happening.
I mean, there is a number of spillovers occurring over the years, in most cases with only a few cases or some familial clusters where there is some multi-spread, but intra-family. There has not been huge outbreaks in the scale compared with those spillovers. I mean, this is 34 individuals got infected in this change of person-to-person transmission, and in the first original outbreak, there were 16 cases that were epidemiologically linked. So those are the only two circumstances previously where we have seen sustained person-to-person transmission, and that is why the work that Nick and our colleagues in Argentina was so important and was picked up by the New England Journal of Medicine. The hantaviruses in general, they have a sustained high fatality rates, and that's why there has been a lot of attention to them. However, because they are so diverse and they are so unique for different areas, in different rodent niches through the world, it's very hard to tackle them with preventive tools like vaccines. However, as Nick mentioned previously, USAMRIID has a program developing a hantavirus vaccine for the more important or more relevant pathogens. Dr. Jay Hooper from our virology division have been pushing that very successfully, that vaccine.
Okay, very good. Last question. Gentlemen, any final thoughts? Anything that I didn't touch on you think is important for the audience to know?
I think that the characterization of the virus in outbreaks and during the spillovers right now is a capability that is becoming mainstream. That essentially, as we have done in the Ebola outbreak in Liberia, or more recently in the DRC, or during the introduction of Zika in the States, or currently with SARS coronavirus 2, I mean, mapping transmission and looking at what are the variations that occur during the outbreak spread is with genomic sequencing is becoming very mainstream.
Right.
What is unique about the study that Nick, Unai, and others have done on this is that what we are trying to bring is precision medicine tools to the outbreak. And what that means is, well, we need to understand exactly what are the factors that are related with spread between, or that facilitate the spread and transmission between humans. If we understand what are the factors that are making a person become a super spreader, are those genetics, are those environmental, are those related with comorbidities. Those factors are going to allow us to try to control and have ways to control the outbreak at the beginning before it expands to a size that is very hard to manage, as what we are seeing now with COVID-19.
Very good. Well, I want to thank you, Dr. Nicholas D. Paola and Dr. Gustavo Palacios, for sharing your time and your expertise. A very interesting topic. I appreciate it.
Thanks a lot for your interest.
Thank you.